Hi, how's it going?
Good, good.
Good. My name is Justin Cunningham. I'll be your student physical therapist today. Before we get started, can I just get your name and date of birth real quick?
My name is Matthew Williams, and my birthday is 10/15/1954.
Perfect. That's what I see on my chart here. Before we get started, I just want to give you a kind of an idea of what we're going to be doing. We'll be using the device that your therapist gave you, it looks like on your previous visit. And we're going to work on some breathing techniques to help you be able to breathe better and get rid of that shortness of breath. It should take about 10 minutes. Well, I'll give you about 5 minutes to ask any questions you got at the end. Does that sound okay?
Sounds good.
Perfect. Okay, before we get started, I just wanted to ask a couple questions I saw while looking over your chart. The first thing I just saw you, it looks like you've been smoking for a while. Can you give me just an idea of about how long you've been doing that for?
Yeah, I smoke I'd say about a pack a day. Uh, and I'd say I started probably about 17 years old, right around there.
Okay. And do you think maybe kind of because of that, do you feel like you are short of breath afterwards at all, or have you seen any decrease in your ability to breathe because of it?
I mean, maybe, but I just feel like, it kind of takes the edge off. I feel like I've been doing it so long, I can't really give it up now.
Okay, I got you. Well, we'll try and help you with what we got then. My second question I got here is, are you currently experiencing any sort of like asthma or shortness of breath currently?
Um, yeah. I recently had to move to a smaller apartment just
Okay.
because I felt like cleaning around my in my bigger area was kind of hard, and I've noticed myself getting short of breath, and so I downsized to a smaller apartment where I wouldn't have to do as much.
Okay. And you said you just moved. Is that has that increased your or decreased rather your shortness of breath then? Has that helped?
Yeah, just because I'm not having to do as much around the house.
Okay.
I get to take more breaks, and it doesn't take as long
Well,
to
good.
clean.
Okay. And then just before we get started, one more. Do you have any goals or kind of things you want to get out of today or what you'd like to get back to? That way I can kind of treat you that way.
I mean, really, I just want to get rid of the shortness of breath. It's kind of keeping me from doing much of anything. I'm just ready to get back to doing, my everyday activities, things I usually do.
Okay. Well, we'll see if we can get you back to that. Um, let's see. Do you have your device now with you? Can I see that
Uh,
real quick?
yeah, I have this thing. The doctor just gave it to me.
Okay, perfect. Yeah, that's your TheraPet. So I'm going to teach you how to use that, and we'll walk through kind of that. I'm going to walk you through some of the things or like what we need to rule out before we get started, and then I'll walk you through kind of why we're doing it too. But just first, real quick, I'm going to teach you how to kind of look at that and maybe detach it real quick. So if you'll hold up the part that has yep, that mouthpiece. That's what you're going to be putting in your mouth. And we'll want to make sure we got a tight seal on that. But you can pull that part actually out and then put it back on. And that's going to be your way to take that off and clean it at the end. And I'll kind of get to that in a second. And then on the other side, you got your resistance. Oh, sorry. The other side of that one right there. Yes.
Okay.
And that should have a little arrow pointing to a number. And so if you kind of select which one you want, let's start with about a four.
Okay.
The lower the number, the harder it's going to be for you to breathe because there's less kind of airway holes. Whereas the higher the number, the more holes, the easier it is to breathe. So
Okay.
I'll walk you through that and we'll kind of get that where we want it. But we're looking for a ratio of you breathing in at about 1 second and then breathing out at about 3 to 4 seconds. So, um, and then that last bit that you were holding up just a second ago, that's going to tell you how fast or how slow you're breathing, and we'll kind of keep a track of that. But we're going to look for about 10 to 20, and the water pressure, I think, is what that's going to show you. So we'll just have you keep an eye on that. I'm going to start by teaching the technique, and then I'll kind of look at that. But I want you to keep an eye on those black arrows. We'll try and keep it right in between there on where
Okay.
you was. Okay. Um, have you currently, or like right now, are you currently having any shortness of breath or anything like that?
No, not just when I'm just sitting here. No, it's not bad. It's more so when I get up to, try and do things.
Okay. And then have you had any sort of ear surgery or anything like that recently?
No, no,
Okay. And then any sort of issues with your sinuses or any sort of head like pressure or anything like that?
not really.
Okay. Um, well, let's get started then. What I'll have you do is we're going to place that mouthpiece in your mouth, and we'll get a tight seal, like I said. And I want you to take a deep breath, but not a full one. So we'll go about two-thirds
Okay,
in, and then we'll hold for 2 seconds, and then I'll have you breathe back out. And we're just using through your mouth, so not through the nose.
okay.
Let's go ahead and
So,
try that.
so you said breathe in to
Hmm
2/3,
hmm
hold, and for how long?
We'll hold for 2 seconds.
And then breathe out.
Hmm So go ahead and try it, and let's see how well it goes. And I'll kind of adjust as we go. Okay. I couldn't quite hear like the actual airway, so it's a little hard for me to tell. But were you able to watch that little line and see, were you in that the two black lines?
Yeah, breathing out is when that thing came up and was in between those two black lines.
Okay, perfect. Well, it looked like you were breathing out of your mouth, not your nose. That's the main thing. They should have given you a little nose clip. So if you do start to feel like it's getting way too easy or something like that, we can watch, and that's probably because you're breathing out of your nose. So we can put that on if you need to.
Okay.
This one, I'm gonna have you try and repeat it all back to me one more time. So just tell me what you remember me telling you, and make sure we're good, and we'll kind of go from there.
So you said that I need to breathe breathe in to about 2/3 um, of a full breath. Hold that for what I think you said 2 to 3 seconds,
Hmm
and then breathe out and try and keep it in between those two black lines.
Yes, that's right. So yeah, we're looking for that when we're breathing out those 2 to 3 seconds, or sorry, when we're breathing out after you've held for 2 to 3 seconds, you're wanting that in between those two black lines. They've done some research to decide like that's the optimal pressure. So that's what that is, if that helps you kind of remember that.
Oh, okay.
Um, so I'll have you let's do it one more time, and I'll just have you point your camera down just so I can see that pressure thing. And then I'll
Okay.
kind of teach you how to, what the amount we're going to be doing this is, stuff like that.
Yeah.
Okay, perfect. I can see that.
Okay.
Okay, that
Could you
looks
see
good.
that?
Yeah, the pressure looked good there. It was maybe a little low at the start, but just as long as you're keeping it between those two black lines, we're looking good there.
Okay.
So now what we'll do is we're going to do this actually 10 to 20 times. So you'll do, depending on how you're feeling. If you're starting to get lightheaded, we'll stop, but we'll do it we'll start with 10 times, and then you'll take a break, breathe normally, and then perform what we call a huff. So I'll teach you real quick. And what we're going to do is it's just like taking a normal breath on the trainer. So it'd be two-thirds all the way in, if you want to do it with me. And then we'll hold for 2 to 3 seconds. And then you're just going to put your hand in front of your face and breathe out like you're fogging a mirror, if that hand is a mirror, and huff. Good.
I
So
need to do that multiple times, like that.
yeah, so we'll do that 2 to 3 times for every 10 to 20 um, of your times you're using those the therapy.
Okay. Okay.
Um, so and we'll do this about twice a day. That's what we're looking at. So 2 times a day, 10 to 20 reps, and 2 to 3 huffs. Can you repeat that back to me just real quick to make sure you got it?
Yeah, 2 times a day, 10 to 20 reps, and then uh puffs, you said in between those.
Hmm
Okay.
And that'll be 2 to 3 times, two to
Two
three
to 3
huffs.
times.
Yeah.
Okay.
Yeah.
Okay.
Um, Last thing I got for you is what we want to make sure that you're not getting an infection or any sort of like sickness or from it, and so we want to keep it clean, and that way we're treating it well. It's just for you, so it's not like someone else is using it, but we do want to keep it clean. So at the end of whenever you're done using it, we're going to have you put just the mouthpiece that you're using and the tube, so not the actual pressure part. We'll put that in warm soapy water and we'll wash it out and clean it and let it sit. And then I want you to make sure you dry that real good, so that way it's nothing is left inside of there.
All right,
Does that
so
make
this
sense?
so this
Mm-hmm.
thing right here.
Correct, right there. That's what you'll be putting in the warm soapy water and not the part that had the two black arrows.
Okay.
Yeah.
Okay, yeah, that makes sense.
Sweet. Do you have any questions for me before I kind of move on?
Uh, no, I don't think so, not at this time.
Okay. Well, if you do have any more questions or anything like that, feel free to reach out. We'll work on doing this using your device, like I said, twice a day. We'll try and decrease that shortness of breath and get you back to where you want to be. Do you have any just anything questions wise on your actual like what you've been dealing with or anything like that I can help you with that maybe your doctor didn't get to answer?
Uh, no, I think we got everything pretty much covered at the last visit, so I just needed to figure out how to use this device,
Okay.
which I feel good about it now, so.
Good. Well, I'm glad I could help with that. If you need anything else, just let me know. I appreciate your time.
Hey, good afternoon. How are you doing today?
I'm doing good.
Good. My name is Creighton Killian. I'm with physical therapy. Today I'll be stepping in for your regular therapist, who I believe did your initial eval. They're out and sick, so you're stuck with me today. I hope you're okay with that.
That sounds good.
Okay. Well, before we dive in here, Mr. Brown, could you just go ahead and verify your full name and date of birth for me for record purposes?
Yeah, it's Charles Brown, 9/12/1956.
Okay, perfect. That's what I have here on your note here. And if you notice me looking off of the screen here, I have your note pulled up, and so I'm just going to be looking at that periodically, making sure I hit everything I need to hit, and making sure that we get everything covered here. Okay.
Sounds good.
All right. So, Mr. Brown. What we're going to be doing today is with my goal with this meeting is to essentially just kind of check in and see how you're feeling after having this procedure done. I believe it was a colorectal surgery.
Hmm.
So I want to see how you're doing with that. We may address looking at some of this pain that you um, have been having around the incision site with
Hmm.
coughing, and then see how that may be affecting your breathing patterns if that's keeping you from breathing in deeply. We'll look at that, and then also we'll address this breathing device that you have, and we'll see if we can't get that figured out. I'll try and show you how to use that because that's going to be very important for you as when it comes to getting better and being able to start breathing deeply again. Okay,
Sounds good.
awesome. And this should only take about 10 minutes or so. I'll save some time at the end for you if you have any questions or anything that you'd like to ask me. Okay.
That'd be great.
Okay, so the first thing I want to do with you, Mr. Brown, is I just have a few questions for you, okay?
Sounds good.
So this first one here is, since you had your eval, I believe it was 3 days ago, have you noticed any changes in your shortness of breath? The speed and production that you've been having, have you noticed any differences in the thickness or color of that?
I mean, since my initial eval, not anything too crazy, but since
Mhm.
my surgery, it's been getting like I feel like it's getting harder to breathe. I
Mhm.
feel like I've been kind of short of breath. Even just like moving, showering, anything like that makes it's pretty hard. And I've noticed some kind of there's some stuff in my whatever you call that gunk that comes up. It's
When you're
definitely
coughing.
yeah, it's been coming like stuff's been coming up in that.
Okay. Okay. Well, that actually kind of leads me into another question that I had for you. Here in your note, it said that you were getting short of breath when you were entering your house, I believe. Do you have steps or stairs by chance when you're
Uh,
walking into your house?
I do have three stairs to enter
Okay.
my house with like a
Okay.
rail on the sides of it, whatever you call that.
Yeah, I was wondering, I noticed that it said that in your note, and so I was wondering if you had a ramp or stairs or something that may make things a little harder when you're getting in and out of your house.
Hmm.
Um, and so with that incision site that you have from your surgery, um, I know it might be hard to kind of recall, but could you just attempt to kind of tell me how bad that pain was on a scale of 1 to 10 and how that is compared to now? Or you could even just tell me if it's gotten worse, gotten better, or stayed about the same.
I mean, I'd say it's definitely been it's definitely been worse as of
Mhm.
late. I'd say it's pretty painful today. It seems like whenever I cough or anything like
Mhm.
that, just any sort of breathing really aggravates my stomach right around that spot they put it in.
Mhm. And so, do you think it would be fair to maybe say that that's kind of keeping you from taking a deep breath potentially? Do you notice that when you're breathing in deeply?
Yeah, it's definitely been limiting my ability to breathe. Yeah.
Okay. Yeah. Yeah, I figured. And that makes complete sense. With really any abdominal surgeries. That's something we tend to see, especially with just the soreness after surgery. A lot of people tend to not want to take deep breaths, and so that's completely understandable. Um, and so then, Mr. Brown, one question that I like to ask all my patients here is, with this hurdle that we're facing, what is maybe one thing that you're hoping to get back to, or maybe a hobby that you're missing out on that you haven't been able to do with because of the shortness of breath? Just kind of clue me in on what you enjoy doing.
I mean, I play bridge with some friends. I'm fairly active in my church. But all of that's pretty hard to do right now. Like I'm not really able to do like I'm kind of stuck just walking around the house out of breath. So
Hmm.
my goal would be to get rid of that shortness of breath, and then hopefully that way I can get back to doing some of that stuff. But
Yeah, yeah.
I'd like to get better. Yeah.
Hmm. And I noticed in your note here that it said you'd have some assistance from your daughter. Um, she living with you? Or is she coming to see you?
Yeah. Oh
How's
yeah.
that look?
Oh yeah. Daisy, she's staying with me. She's until I get a little bit better. She's supposed
Yeah,
to stay with me and help. Yeah.
that's super nice of her.
Yeah.
That's awesome. Um, okay, I'm just looking through here, making sure I don't have anything else that I wanted to ask you. Think we are good there. Okay, so we'll go ahead and move on here. One quick thing that we can address is with that pain that you're having when you cough. Um, we can we can look at maybe changing the way you're coughing a little bit, and maybe I don't know if they told you this in the hospital, but something that we like to do with our patients after they've had any type of abdominal surgery or like people with rib injuries is you could use a pillow almost as like a splint,
Mm.
where I don't know if you can see this here, but
Mm-hmm.
you place that pillow right in front of you, and you kind of brace that pillow against your incision
Like I'm
when
giving
you're
it a hug
coughing.
almost.
Yeah, yeah, yeah.
Okay.
When when you brace that pillow against you, it limits the amount of movement and strain on that incision site. And so that might just be like a quick way to help kind of ease some of that pain when you're coughing. So it might be a good idea to try that and just kind of see if that helps at all.
Yeah. Okay.
Another thing you can do, if that's not helping enough, is instead of doing that harsh cough where you're breathing in and really just expanding, forcing everything out, is you can do what we call a huff cough. And so what that looks like essentially is you're still going to inhale like you would if you were going to cough, but you're going to sit up nice and tall and you're going to inhale and you'll hold it, and then instead of making that harsh cough out, you can put your hand up and it makes it a little easier. And you're gonna try and pretend like your hand's a mirror, and you're gonna blow out, and you're gonna try and fog up that mirror. So it's gonna look like this. You can do that three, four, five times,
Okay. Okay.
and you're
Yeah,
just
it's
gonna
a
try
little
and
less
forcefully
painful.
get that air out. And that's just to kind of help ease some of that pain. Maybe make it a little easier for you to cough and kind of get some of that junk out of your lungs.
Okay.
Okay.
Thanks for telling me.
Yeah. Um, and so do you have that breathing device with you currently?
Yes, sir. I got it right here. I have this, and then I have a bunch of these different colored things.
Okay. Perfect.
They were kind of rushed giving it to me, so they didn't really tell me
Yeah.
what to do with it, but I got
Yeah.
it.
Things move fast in the hospital, so a lot of times they don't have time to really go through and show you how to use things. But we'll get it figured out here. And so what you have in your hand there, that's actually called an inspiratory muscle trainer.
Okay.
And you don't have to remember that name. You're not going to be tested over it or anything. But that's just kind of give you an idea of what it's called. So with it being an inspiratory muscle trainer, we're going to be working on that inspiration or breathing in aspect, okay?
Okay.
And so I want you to think of this device as like you can think about it like when you're lifting weights and you're trying to get your muscles stronger. That device that you have in your hand is going to do the same thing for your breathing muscles, okay?
Okay.
When you're breathing in. And so you have that main piece in your hand, and that white piece that you have, can you raise it up a little bit for me?
Yeah, yeah, right.
That white piece that you have in your right hand there, that's the mouthpiece. And
Okay.
then in your left hand there, you have your T piece. And so those other colored things that you have are resistors.
Okay.
And so those resistors are going to be what's going to provide the resistance. I believe it goes in on that side.
On this one.
So,
Okay.
and so those resistors there are going to provide varying amounts of resistance for you. And so I think, is that the dark blue one right there?
Yes, sir, it is.
Okay, so that's going to be the easiest one. It's going to provide the least amount of resistance for you. And we can start with that one today just for purposes of showing you how to use it. But, eventually we want you to progress and begin to use um, the resistors with more resistance. It's just going to continue to help increase your lung capacity, okay?
That sounds good to me.
Okay, and so just talking a little bit about this device. When we're using this device, obviously we're going to want you seated in a chair, which I'm assuming you are right now.
Yes, sir.
And you're going to have your feet nice flat on the ground. And what we're going to do is we are going to place that mouthpiece around your mouth there, creating a pretty tight seal. And all you're going to do is you're going to just breathe in and out normally. Yep, perfect. You do that a couple times. Okay. And what I want you to focus on is actually, do you feel that resistance when you're breathing in?
I mean, it's there. It's not very strong though.
Right. And like I said, that's going to be the easiest one. And so if that's too easy, we can start on a higher level. I believe you might have had in your packet with that device a chart that kind of shows,
Oh, yes, sir.
um,
Uh-huh. This I got it right here. This thing.
yeah, that exactly. So you see that t dark blue at the top, that's the easiest
Mhm.
one. The yellow is going to be a little harder. And all those numbers to the right, all those mean is that you have a diameter, that little circle diameter on the resistor right there.
Mm-hmm.
That's going to get smaller, and so it's going to make it harder to breathe for you.
I see. Okay. Okay.
Okay, and so um, now that you kind of have the gist of how it works, what we're going to want you to do with this device is you're going to want to aim for anywhere from 15 to 30 breaths.
Okay.
And you don't have to go through all 15 to 30 right now, but
Oh,
you're going to want to do 15 to 30 breaths. And you're going to want to do that 2 times a day.
okay.
It's generally recommended that you do it for 30 minutes a day, but you can just do it 2 times a day, say 15 minutes. Okay?
So you said 15 to 30 times a day? For
15 to 30 breaths.
breaths. And then
And you're going to want to do that 2 times a day.
okay, okay.
And so let me make sure that I'm explaining everything to you right, not telling you anything wrong here. Yeah, and so 15 to 30 breaths. If for any reason you were to experience any shortness of breath or you're not feeling well, if you feel like your heartbeat starts going super fast, moving super fast, really anything, any bad effects that you're feeling, it's
Uh-huh.
okay to go ahead and just stop and
Okay.
maybe talk to your doctor and see if y'all can't figure out why that's happening. Or next time you come in to see us, we'll look at that and see if maybe we need to, scale back on the resistor level or make sure that nothing serious is going on. Okay.
I got you. That sounds good.
And so, like I said, that 15 to 30 breaths is going to be your good zone that you want to be in. And a good way to gauge on whether you need to move up or maybe scale back is if you can do more than 30 and it's pretty comfortable, then you could probably go ahead and just make that resistance a little bit harder.
Okay.
Make sure that you're working.
So go up to
Um,
like a yellow or something like
yeah,
that.
yeah,
Okay.
yeah.
Okay.
And then if it were to be too hard and you can't get 15, then it'd be a good idea to go ahead and scale back down and keep working at the level that you were previously on.
Gotcha. Makes sense.
Okay. And believe that's good there. And then just a few quick house cleaning rules, things that I wanted to ask you before we go ahead and clear this and make sure that you're good to use it. Um, is I'm just going to run through a quick checklist and you just tell me yes or no if anything applies, okay?
Okay.
You haven't had any inner ear infections here recently, have you? I didn't see anything in your note. No?
No, sir. Uh-uh.
Okay. Um, do you have asthma? It didn't say anything in your note. I just want to clarify and make sure.
No, I don't. No, no, sir.
I noticed you did have an inhaler. Was that for, I'm assuming that was for COPD?
Yes, sir. Yes, sir. That's
Are you currently smoking or,
no,
uh,
sir. I mean, I smoked for just about 30 years or something like that. But when I
Mhm.
turned 50, my doctor told me that was probably something I needed to give up. So
Yeah,
I've been off that for about 15 years.
that's awesome. That's awesome. Yeah, I put those two together. I put them hand in hand. I assumed that those things were associated there.
So,
Um, so no asthma. If you were to ever have any ear discomfort while using this device, that'd be another reason to maybe refrain from using it. Talk to your doctor, talk to one of us, and see if we can't get that figured out before you start using it again.
okay.
And then the last thing, have you had any recent surgeries dealing with sinuses, like in the oral area down here, cheeks, up here, anywhere?
No,
No.
I mean, I have my stomach surgery, so but that's about the only thing I think
Okay.
that counts there.
Yeah. Perfect. Yeah. Yeah. That's perfect for me. And then just the last thing I wanted to run through with you, this will be really quick, is just making sure that we clean this device periodically. We don't want you potentially coming down with any infections from
Okay.
not cleaning this device. And so this with this device, it's pretty simple. So if you'll put
Mhm.
that thing up in the screen for me, yep, perfect. Um, and so what you'll need to do when you go to clean that is that white mouthpiece there, it actually comes off. And that plastic piece that's on the mouthpiece can detach as well.
Oh, okay.
It might be a little hard. Yeah, that'll come off. Yeah. And so what you want to do once you get all those pieces detached is you can use some warm soapy water and kind of soak those pieces of the device in that warm soapy water. And then obviously when you pull those out, you'll want to let those dry. And you can do the same for that T piece as well that you had.
Okay. Do I need to clean like this thing or anything? I mean, I don't know.
I think just putting it in the soapy water, making sure that that water gets through everything, should suffice.
Okay. Okay. That seems simple enough. Just everything in soapy water apart.
Yep, yep. And then just one thing, make sure that that T piece that you had when it's drying, that it's flat and that it's not like standing up.
Oh, okay. So on its side like that.
Yeah, yeah,
Okay.
exactly,
I
exactly.
can do that.
Um, and then yeah, I believe that that is everything. Obviously, with this device, don't expect it to just work overnight. Most of the research points to it being anywhere from 4 to 6 weeks before you see any super great results. So just take your time with it, and it will work. It just may take a few weeks. Okay.
So just like my biceps that are coming in, I need to
Same
wait a
thing.
little bit on those too.
Same thing. Yep.
Okay.
Yes, sir.
Okay.
Yep. Um, do you have any questions for me?
No, I mean, I just want to get back to breathing normally, so I appreciate your
Yeah.
help today.
I understand that. Well, thank you for letting me meet with you. It's been a pleasure, and we look forward to seeing you next time you're back in the clinic.
Well, I appreciate it. Thank you so much.
Yes, sir.